Hi everyone, my name is Norma and I've tried to record this video like a million times, so sorry if it's a little messy, but I actually am going to be starting nursing school next month. Yay! I'm super excited because I actually got denied and waitlisted and finally I'm accepted, so I can't wait to kind of like document everything and show you guys my little nursing school journey. So stay tuned for that, or subscribe, like the kids say, subscribe if you want to see more. So this video is going to be about what it's like to be a CNA in pediatrics. So I'm actually hired for NICU, like NICU is my home unit, but I am often floated to different departments that are within like the children and mother units. So I go to pediatrics first. That's like the first place I'm floated to if they need me. And for them to qualify for a CNA, they have to have 8 patients or more, and that unit houses 12 patients, so that's like the max. So if I'm not floated to PD, I'm floated to newborn nursery. So if you want to see a video about newborn nursery, let me know, because I can totally talk forever about newborn nursery. And where else? Sometimes I go to postpartum and labor and delivery, but it's not super common that I'm there. I'm mostly in pediatrics or newborn nursery, and not as much to NICU because the census is usually kind of low in my hospital, so they usually don't need me, but sometimes they'll call me to come help with a few things, and I usually go and help. So my shifts are from 6 a.m. to 6 p.m. so they're 12 hours, and right now I'm full-time, so it sucks, but when I go back to school, or like when I start nursing school, I'm gonna go down to PRN. But right now I'm full-time, and at my hospital, and I think most hospitals, you have to be there like clocked in 15 minutes before your shift so that you can get report or kind of get situated and stuff, so that you're not there past 6. And so the first thing I do is like I clock in, I go to pediatrics. We have a closed unit, so I have to put in a code. Actually now we upgraded to like swiping our cards, which is so cool. So I swipe my card, I go in, and the night shift CNA will give me a report, and usually the report consists of like letting me know if there were any contact precaution patients, which usually in pediatrics there's a ton, like most of the patients are contact precaution, so they'll just kind of like brush through that and let me know. And they'll let me know if like any of our patients have had fevers, to kind of watch for that. And what else? Just like a typical report. They usually already have a printed list of all the patients we have in the unit, and so I like to look at like the age, if they're like babies or if they're a few months old or whatever, and I kind of make my list where my vitals go, and I write down like all the patient names, what room they're in, how old they are, just so that I can kind of have an idea. I think that's like about it. If there's any major thing, like let's say there's a patient that we're checking their sugar, they also let me know, because the CNA does that. Like also the nurse can do it, but it just makes their job a little easier if we help with that. So the main job of a CNA, I think in most hospital units, is to take vital signs. So our vital signs are every 4 hours, so they're due at 8 a.m., 12 p.m., noon, and at 1600, which is 4 p.m. I like to start my vitals at least like 40 minutes before they're due. So I get in at 6. First thing I do is make some coffee, because hospital life, healthcare life, you need that caffeine. So I usually make coffee first. If I brought breakfast, I'll like eat a little bit of it and drink my coffee. And then oh, the first is disinfect everything. Like, I disinfect the computer I'm going to be using and all the phones, because people tend to like hold the phone super close to their mouth, and I hate that. So I disinfect like all the phones, the computer, my vitals cart. I disinfect like the cords and also like the thermometers, everything, because especially like in a pediatric unit, there's a lot of bugs swimming around on things, so it's always a good habit to disinfect. In my hospital, I kind of take the role of like a CNA and a secretary, so I help the nurses with like answering phone calls, answering the door, because we have like a doorbell for visitors to come in, answering like call lights. And so the morning vitals, I kind of start them like at around like 7:20-ish, and I like to stock up my cart with like thermometer probes, because I always run out for some reason. I like to put the thermometer probes, the different blood pressure cuff sizes, because pediatric units go from newborns like a few days old to 18 years old, so we have everything in between. So anyways, I like to put the different blood pressure cuff sizes in my cart just in case, because a lot of the times they kind of get lost. They tend to like, the kids throw them or play with them or whatever, and then they get lost. So I like to put the different sizes. And the vital signs that we have to get are blood pressure, pulse, respirations. Very important, the respirations. A lot of the times I see people don't do them correctly, but those are really important, especially with like our patients who are there for like respiratory issues. Super important to check respiration. Also the oxygen level, so they have their little pulse ox machine. We can check just like right away what their oxygen level is, and temperature. So for most of our patients that don't know how to check their temperature oral, we check it axillary. And for the little ones, I have to kind of hold their leg down, because I like to check their blood pressure on their leg. You can check it on their arm or really wherever, but I like to do it on the leg just because I feel like I have a better grip and I can secure the leg a lot better. First thing I do is I go into the rooms. If the parent is awake, I introduce myself. I say, I'm Norma, I'm going to be your CNA today, and I'm going to check your child's blood pressure. And then I go on to check their vitals. I like to look to see if they're missing anything, like if they need diapers or formula or water for, you know, the parent or anything. If I notice something, I'll ask and be like, hey, do you need more diapers, or, you know, or whatever. If I see that they have pretty much everything stocked up, I'll still ask if they need anything, because sometimes, you know, I miss them. Oh, and after I introduce myself, I write my name on the board, because there's a little spot for nurse assistant, and I put my name. And I pretty much do that same routine with each patient. So I go through each room. Another job duty of mine is, you know, asking if they need a bath, if they want to take a bath today, and I set everything up. If they have an IV, I cover it with like a plastic that we have, and I tape it just to make sure that they don't get it too wet. And I change their linens and discard of like any dirty linens and throw out the trash. Like, I like to just make sure that every room is kind of neat and organized, and also stocked up with like gloves for us, making sure the trash isn't too full. And, you know, because we do have housekeepers, but, you know, if you notice something like that, even as like a nurse, anybody, you should take out the trash if it's full. Or, you know, doing little things like that really does make a difference and help the patient feel more comfortable and clean and happy overall. Whenever a nurse needs to start an IV or, you know, redo an IV, we have a treatment room that we take the patients to. And usually what I do, like my main job in that situation, is to hold the patient down with my whole body because these PD patients are fighters. If you work in PD, you know that a lot of these little kids, they will kick you in the face. They don't care. Like, they're just trying to survive and not get poked. I've gotten really good at holding the patients down and kind of like securing the site that the nurse wants to start the IV at. Sometimes the nurses ask me like to pull the skin, like let's say they want to start the IV here. Sometimes they ask me like to help them pull the skin so they can see like where the vein is, which is super cool. I feel like I've learned so much about starting IVs just by watching them and helping them. And actually I got to really help one time with one of the nurses to secure the IV, because she actually had me put the tapes, because they all kind of know I'm going to be starting nursing school soon. So I thought that was super cool. Like, I actually got to put the tape around and secure it, and then like wrap their arm and put we have like little arm boards for the little patients, so I got to put the arm board, and it was super cool. Like, I feel like I really learned a lot that day. Another thing that I can do is help also hold patients down whenever the nurses are gonna do like a cath, which is whenever they need a sterile urine sample, they kind of put like a little catheter into the patient. But it is really like, you know, it sucks like when you really think about how scared they are and how it kind of, that like feels so violating. You know, I try to always just be there, try to talk to the patient while I'm holding them down, try to like make them feel better, calm them down, because it is super scary, you know, being a little kid and being like, what the heck, why are you touching my stuff? Like, get away from there. So other than that, you know, I'm just answering call lights, helping patients with whatever they need in between, you know, vitals, helping with baths, helping change linens, taking out the trash, what else, like disinfecting areas, answering the doorbell, and, you know, just answering any questions that I can answer as a CNA. And I also help sometimes with like the charts. I have access to print out certain like consents or stickers or any. I can also call to get rooms cleaned. Like if a patient is discharged, I can call and get that room cleaned stat, so that we can admit a new patient if we need to. Another thing that I do is whenever we're getting admissions, like admitting a patient into our unit, I set up the room and I put everything that they could possibly need in there, and I also put like extra blankets for mommy or daddy. So yeah, I pretty much do a lot at my job in pediatrics, and I love it. That's like, honestly, I feel like that's my calling. I'm gonna be a pediatric nurse. Like, I know I am, because I love these kids so much, and a lot of them have like so much personality that you can already see, and it's just great. I love my job. I'm so blessed and thankful that I can get to see all of this before I'm actually a nurse. So yeah, I can't really think of anything else that I do. I mean, I do everything. Like, as much as I can. I do as much as I can. Sorry, thought I heard something. So yeah, if you guys like this video and want to see more, let me know. I'm so excited to be talking about nursing and all of this stuff, because this is like a passion that I have. I actually have like a fitness Instagram, because I had lost like 70 pounds once upon a time. So I have like a fitness Instagram, but nursing is my absolute passion, and I want to talk about, you know, my journey, and I want to inspire you guys and talk about like how I didn't get accepted the first time around. So I know how hard it is, and I know like what I did to improve myself, basically. So if you guys want to see videos about anything, let me know. Like this video, smash that subscribe button. Okay, sorry, yeah, I've been talking in a low voice because I don't want people to hear me, because my mom is like out there and I don't want her to hear me. But anyways, bye. Thank you, thanks for watching also. Okay, bye.